Well, good afternoon. It's great to be back in Southwest Florida and here at Amavita. So I want to thank you guys for hosting us for this announcement regarding long-term care visitation. I also want to recognize the acting secretary for our Agency of Healthcare Administration, Siobhan Harris, who, is this your public debut?
Yes.
Okay, so she's started she's been with the agency for a while, done a great job, and so she's been acting secretary, I think, since last week or 2 weeks ago, last week? Okay, so we appreciate it. And then I'll make some comments and we'll introduce everybody and go around the horn here. So, but I do want to thank Amavita Living for hosting us, and thanks to the caregivers who were here to tell your story. We, at the beginning of the pandemic, very clear that the COVID-19 disease was particularly lethal with respect to our elderly population, but particularly elderly that had underlying health conditions. And so we looked at not just nursing homes, but all long-term care facilities as probably the ground zero in terms of the most at-risk population, not just because of the age and underlying health of the residents, but also because you do have more communal living in some of these, and you have an opportunity for significant spread. So we did a number of things at the very beginning. One was requiring the staff to wear PPE, masks, and gloves, and we've sent 10, 20 million masks to the facilities throughout Florida, gloves, face shields, gowns, you name it. The state viewed that as a top priority, and we're proud to have done it. We also prohibited hospitals from sending a contagious patient back into a nursing facility or long-term care facility, because obviously that would be a vector for spreading. But we also made a tough decision to prohibit visitation into nursing facilities. So basically you had the staff and the people that worked there and the residents, and at that time there was a lot of uncertainty about the disease. As many of you know, there was not much capability for doing a lot of robust testing, and so the concern was people coming and going as this disease is out there, then you end up having more outbreaks. And so that was a decision that was made to try to mitigate the effects of COVID-19. And I think it did do that, and I think we had fewer outbreaks as a result of that, as well as other things. At the same time, that's a decision that comes with costs. And the costs are depriving residents from being able to be with their loved ones. Now, you're able to do FaceTime, and we sent iPads to a bunch of facilities. Some of them you could do some other types of distance visitation, but it's just not the same to be in a facility and not be able to be with people that you love, not be able to hug them, and so on and so forth. And so as we were dealing with the outbreak over the summer in the Sun Belt, I was very much concerned about the effect that this was having. Yes, we need to mitigate the effects of this disease, but this virus is not the end of all health issues. Health is about people's physical, mental, emotional, social well-being, and so mitigating one virus needs to be done, but it shouldn't be done to the exclusion of anything else involving people's well-being. And so we looked at it and said, you know, we now have a huge amount of testing capacity. We have enough, no one is without PPE. We have all the PPE we need. We know certain ways that you can mitigate this. And so we made the decision in August. I had a task force convened. It was actually headed by a woman out of Jacksonville whose husband was in a memory care facility. And because of the visitation restriction, she was not able to go in and see him. That was obviously very frustrating, and so she decided to start working at the facility. And she worked at the facility, was able to see her husband, and then became an advocate for getting visitation into these facilities in a safe way. And when we were going over it, they were very thoughtful. I had a committee. I had Siobhan's predecessor. I had the Surgeon General. I had some stakeholders from throughout Florida. And basically we said, look, even having these things on lockdown, you still have outbreaks that happen. It's not like you're 100% guaranteed, even if you don't allow any visitation, to not have COVID. We've seen, I mean, in the Miami outbreak, there were a lot of those facilities that had it. So we're like, all right, we're just gonna have to mitigate, but we can't not have visitation, so we're gonna do the visitation. We understood that that may carry a certain amount of risk in terms of, if you have one more person, who knows? And so that was something that we were cognizant of. But I can tell you, I think there's something about when people are happier, when their spirits are higher, when the families are involved. I think the staff performs better. I think it's just a better mix. And so since September 1st, we've actually seen the number of cases in long-term care facilities statewide decline by 70%. And so this was something that we were bracing to see some outbreaks, and yet it's been a really steep decline. And so I think it just goes to show that I think when you have a more holistic approach, I think that better addresses some of these other concerns about social well-being, mental well-being. But I also think in many respects it's a better approach for dealing with COVID-19 as well, because I think everyone's spirits lifted, and I think that the mitigation is that much more effective. And so today, we knew that that announcement in August was just the first step. We wanted to obviously evaluate and see how things went. But I think and you'll hear from some of the stories here, I think the families have just universally been very, very happy with being able to be reunited with their loved ones. And, I hear people say, oh, well, you shouldn't have Thanksgiving this year or this. And I'm just thinking to myself, shouldn't individuals be in the position to be able to make those determinations? And if a family is in a situation where they're behaving in a safe way and the facilities are doing what they need to do, we need to be able to have family connections. This is very, very important. Not everyone who's in these facilities is on the brink of passing away. I mean, there's different reasons why people come in these, but we do have some folks who are very up in years, have health problems. And the number of folks who are in these facilities who said, look, I don't want to get COVID, but I want to be able to be with my family. I want a life worth living. And so I think it's been very, very successful. I think it shows that you got to look at the whole enchilada in terms of health. It's not just, I've been citing this World Health Organization constitution because they talk about, it's not just absence of disease that makes someone healthy. It is the social connection, it's the physical fitness, it's mental health, it's all these things that go into what we really should consider health. And so today, we are ordering the Department of Emergency Management to update the policy on nursing home and long-term care visitation and do it in a way that's going to facilitate even more connections. So first, it removes the current prohibition on children visitation. That was put in. There was discussion amongst the task force about having the kids, and they decided to just wait for now when they gave the recommendations in August. But I think we're also in a situation where we know particularly the young kids aren't major vectors of this, and I think the same mitigation that's been done in other ways can be done there. Second, it allows for outdoor visitation regardless of any COVID cases in the facility. So currently, policy requires general visitation to pause for 14 days if there's a positive test of a resident or staff member. But with this update, that will only apply to indoor visitation. And basically the reason for that is we just don't have very many cases that get linked to outdoor activity. I'm not saying it can't happen. Obviously, it could happen under the right circumstances. But being outdoors has been something that's been very positive. And particularly as the weather starts to get better in Florida and gets a little bit more, a little cooler, I think we're in a position where that's going to be very, very viable. And then also, the pause still only applies to general visitors anyways. The compassionate caregivers, of course, can always continue to visit indoors regardless of any positive cases. Third, it clarifies something which we meant to be clear the first time. There's been different folks in different parts of the states have had questions about it. But we're not requiring social distancing for compassionate caregivers. These compassionate caregivers are in there tending to a loved one. They can give them a hug. They can do what they need to do. And then fourth, the order eliminates the 5-person maximum number of general visitors and replaces it with a general requirement that facilities select their own limits. So what we're trying to do on this is really empower the residents, the families, and the facilities to be able to make good decisions. And we have more tools. So I've been talking about, these new rapid tests that we are focusing very heavily on, not just nursing homes and long-term care facilities, but all senior-dominated communities like the Villages or some of these other places throughout Florida. And we did not require there to be testing of visitors initially, and we still haven't required it now. And part of the reason for that is if you're going to visit on a Friday and you do a PCR test on a Monday, get the result back on a Thursday, yeah, you may have been negative on Monday, but who knows, you may have been infected since then. And so it just wasn't something that was something that we wanted to require. At the same time, this is now a 15-minute test. It's an antigen test, 15 minutes. Anyone can do it. You literally just put the reagent in, do the swab. You don't even have to stick it up to your brain like some of these. It's just a normal nose tinge. Put it in, shut it, there's adhesive, and you get a result within 15 minutes. And so this is something that if you have, especially as the holidays come, if you have residents that may want to go home for holidays, maybe they have people come visit here, we're going to keep sending these to these facilities. So you can test the visitors and your staff as much as you want to, and we're going to keep supplying these tests for you. And I think that this is a really good use of that. And our view on this is, there's been so much just kind of, hey, drive through, community test, just do it. There's not really a lot of method to that. It's like people come or not, and that's just the reality. Most of those people that are going through there have very mild or no symptoms. And so the number of people that go to even a hospital out of those test sites is very small. This is testing, I think, with more of a purpose. And so the purpose may be continue to screen the staff to make sure that the staff isn't bringing it in, or with the families and friends to really be able to open the window for as much robust, safe visitation as possible. So we encourage everyone to look at this and to use these tests appropriately. It comes in a box, and there's all these individual things in one packet. It's got the swabs, it's got the reagent, and you just do it. And it's very, very easy, and we think that really allows the testing to be more effective. If you can get a result quickly, then testing, I think, makes a lot of sense. Not foolproof. These tests have about a 1.5% false positive rate. And so if you do test positive, you may want to get confirmed by PCR or try to do another antigen. But it is what it is. None of these things are going to be perfect, but we think that it's something that's really, really good. So I think the stories have been really, really, one, without visitation, the stories were very heartbreaking because people were struggling. And they were struggling in ways that I think we had a duty to mitigate. And so I think what we've seen since then is a lot of relief from a lot of the families, and I think a lot of great heartwarming stories about people who have been reunited with their loved ones. And so we want to continue moving forward for that. So you want to just say, Scott, some stuff about the facility? I'll turn it over to Siobhan for a few comments, and then we'll hear from our caregivers about what they've been doing over the last couple months.
Yeah, well, Amavita is a resort senior living community right here in Fort Myers, and we do independent living as well as assisted living and memory care. So we're excited to have the governor here, and we're excited about this new news, and I think we'll pass it around the room.
Great. Okay. Siobhan?
Thank you, Governor. I'm happy to be here with you and everyone here in this room. Our agency regulates long-term care facilities, which is inclusive of nursing facilities. And throughout this pandemic, since its inception, our focus has been on supporting those providers that are on the front line, ensuring that they have the tools and resources that they need to protect the most vulnerable among us. We know that some of the precautions that had to be put in place early on were for everyone's protection, but took a toll on residents and caregivers. And we're pleased to be able to make these strides forward. We know our long-term care facilities have the tools and resources, and we trust that they will make the right choices as we move forward, as we've seen our numbers stabilize and continue to progress in that manner moving forward.
Great. Thank you. All right, so we have a number of folks here. We have Christina Griswold, whose father is a resident of a long-term care facility, not this one, but in Fort Myers, and she's been able to visit with him since the visitation prohibition ended. So turn it over to you.
Thank you, Governor. My name is Christina Griswold. My dad is in a facility not too far from here. He has been there a little over 2 years. He's done okay through the whole pandemic. What he didn't like was he didn't like his activities restricted. He did not like being locked in his room. And we saw a progression or a degression in his attitude and his behaviors as a result. I was very thankful that the task force came together along and gave the governor ideas for the order in September because that first hug that I got with my dad was just priceless. And since then, he's felt a lot better. He's more happy. They've also reinstated the communal dining, which means he's able to see his neighbors and his friends. So overall, the first order did a lot of good for the residents and their families, and I'm really looking forward to the next step and being able to celebrate the holidays.
Thank you. We also have Brenda Tate here, whose husband Dewey's in a memory care center. Dewey was a successful soil stabilization engineer and manufacturer, and given his condition, obviously, it's important for Brenda to have that interaction. So can you talk about it?
Thank you, Governor. Yes, my husband is a resident here in Amavita Living, and honestly, his cognitive decline because of Alzheimer's has not paused because we're in a pandemic. So as his wife and his caregiver, my concern has been to miss critical time with him, that he could be remembering me, be remembering our children, our grandchildren. So I'm very encouraged that visitation is opening back up. I can pledge that I will do my part to be responsible and be safe and take all precautions, because I'm not concerned only about my husband but about others. The idea that we'll have rapid testing is exciting too, because I think that's going to give everyone much more confidence as families are reunited with their loved ones.
Thank you. All right, Elke Podlasik is here from Sanibel, and she recently helped her mother settle in an assisted living facility and has already been able to do visitation. So.
My mom is at Amavita for the last 2 years. She was first in independent living, so it was easy for her to come and go, and now she transitioned over to assisted living, and I couldn't even imagine not be able to see her, or she couldn't see me or her grandkids, because first of all, she doesn't speak any English, so it's even more difficult. So helping her be able to see her and translate and help, that's just amazing. And again, with all these tests, we need to open up these old people. That's all they have. It's their children and their grandkids. So, thank you.
Thank you. Okay, Ms. Smith, can you talk about your role and what you've seen?
Yes, thank you, Governor. I'm Jaritza Smith. I am the on-site nurse practitioner at Amavita. And what I have seen during COVID is that residents have become depressed, a lot of anxiety, a lot of behaviors, because they're missing their families. It's been a blessing since the visitations did start, even though they were a little restricted, because we have seen an improvement in all of those areas. And their quality of life has improved as well. I think now with these new rules, I think that's going to be even better for them, and their cognition is going to continue to improve or stabilize. So we find it a very welcoming news, very welcoming.
I would say that when we started the communal dining, like Christina mentioned, if you could see the life in these individuals, if you could see a battery becoming charged, it just charged up. And then as the visitation picked up and we were able to expand that, and now they're fully charged, and it's really wonderful. And I do all the quick testing, especially around the holidays, is going to be fantastic.
Yeah, no, absolutely, and I think it's really, really important that we do all we can. I mean, we focused obviously a lot on protecting from the coronavirus, which is obviously something that we need to be doing, but we cannot have a blind eye to all the other aspects. And so to see people's spirits higher, hopefully this will even be better. I think that's great to see, and it is important for public health as well. We have really focused on protecting the seniors in these facilities. We went starting in, once the testing supplies became a little bit more prevalent, we offered tests to all the residents across the state. I had National Guard strike teams going around, testing staff, testing residents. And then as we went through that iteration, and we have 4,000 facilities in Florida, so it's not like, some of these states, they have like 30 facilities or 50 facilities. Well, it's a lot different when you have so many. And so, we had 50 teams dedicated to that, and they did that for a 2-month period. And then in June, we instituted a self-swab test for all the long-term care facility staff, which is over 200,000 staff members. And so they would do biweekly testing, and obviously positive people would be isolated. And so we put a lot of money into that because we thought it was important. But then now with the 15-minute rapid test from the federal government, the federal government had sent about a month or two ago some of the machine-based antigen 15-minute tests to some of the nursing homes. The problem is they didn't have really enough cartridges to do all the testing that they wanted with it. So what many of them started, they just continued doing the self-swab that the state had previously provided. Now that we have this Binex net now, and really have, unless something happens with the distribution of this, there's 150 million going to be produced by the end of the year. That will be more than enough for all these facilities to be able to use it to the hilt. And so this, I think, is really going to be something that is significant, and we're going to continue. Our first priority is the 800 skilled nursing facilities that we have, HHS is supplying them directly. Then the 3,200 other long-term care facilities, the state is taking our allotment, supplying them directly on a weekly basis. And then we've asked for senior communities who are not in with assisted living, but just places like the Villages, places like Sun City Center in Tampa, Century Village in South Florida, that if they want tests, we will send them. So we've actually had people request. We created an email address, rapidtestforseniors@em.myflorida.com. And as those communities request, then we can send it. Because really, it's the same principle. If you're in just an active senior subdivision and you have people that are coming in, again, you're not required to have people tested, but if that would give you peace of mind, you could do a 15-minute at your community center or something. Why not go ahead and do it? I think that's something that's very, very important. The other thing, so we're going to continue, as we get these in, we'll continue to push them out, focusing on that. Now, we have sent some to schools. They're also being used at our community, some of our community testing sites as well, which is fine on the community testing sites, but this is really testing with a purpose because it's expanding people's horizons. So that's something we're going to continue to be doing. The other thing that we're ready for is the distribution of some of the new therapeutics. You hear an awful lot of talk about vaccine, and look, I would love to see an effective vaccine produced as quickly as possible. The fact is, it's not as easy as people make it out to be. I mean, we don't have any coronavirus vaccines that's been produced, and the efficacy of even a vaccine that is somewhat efficacious may not be as efficacious to the most at-risk people. So there's a whole bunch of things, and so we hope for the best. But I think to put all the eggs in the basket of a vaccine and say, oh, well, we'll get the vaccine, everything's gonna go away, I'm not sure that that's the proper way to plan. So we've really been interested in pushing out as many therapeutics as possible. We have done it with remdesivir. We've done drives for more donations of convalescent plasma, which is good. But I think these antibody cocktails that are being developed potentially can be a really significant step forward. I mean, it's not going to prevent an infection, obviously, but if it neutralizes the infection and reduces the severity of the illness, obviously that could save lives, and it could also prevent people from having to be in the hospital for a long time and have a more mild illness. So Regeneron has an antibody cocktail, and then Eli Lilly has a similar cocktail. The federal government already has, I think it's already been produced. What they're waiting for is enough data to get to the FDA where the FDA would be justified in doing an emergency use authorization. So once that happens, in my discussions with HHS, I think the plan is to send them through the states. And so if that's the case, then we're going to take those and work to get those out. I think that our priority for that, obviously we want hospitals to have them, but if you look, I mean, we have, we've had between 2,000 and 2,300 COVID positive patients in the hospital being treated for COVID for the last month or two. And so, I mean, obviously you do that, but I'm thinking beyond that, if there's an outbreak at a long-term care facility, maybe you have that available for all the other residents, maybe some of these other senior communities. And so I think that is potentially a game changer. So we'll wait for the data, we'll wait to see what happens. But from my discussions, this is not going to be something that's going to take another 6 months. I mean, we're looking at hopefully a decision one way or another very shortly. And the fact that this stuff I think is ready to go means that if it gets emergency use, you could then start to see it in the community very shortly thereafter. So therapeutics, I think, are very, very important. And look, if we're called upon to distribute the vaccine, we would do that. We would, I think, focus it on the people that are the most at risk of serious illness from this, and obviously depending on how much is available. So, but I think this is a good step forward for some of our most vulnerable folks. I think the families have done a great job. I think everyone wants a safe environment. But they also want to have an environment where there's a lot of love and a lot of caring and a lot of connection. And I think that we've gone a long way to get there. This gets us a little bit further in that direction. And I know that, hopefully this will bring a lot of relief to a lot of folks. And with that, we can take a question.
Mr. Governor, I'm Rachel Lowe with Fox 4. When it comes to flu season and the pandemic still going on, what's your message to Florida residents and visitors when it comes to the health?
Well, so it's an interesting thing with flu season. Obviously people get flu shots. It's marginally helpful. I wish it was more helpful. There's a question about how COVID will interact with influenza. Does COVID displace influenza? Because if you've looked in certain parts of the world that just had flu season that had COVID, they had a lot of COVID. They didn't have as much flu as they normally would. And so we're looking for that to try to see. Obviously, we would like to not see any COVID, but we'd rather do one or the other than have kind of both combining, because you are going to see an increase in prevalence in flu, all things being equal, if depending on what happens with the interaction with COVID, particularly as we get into December, January, February. That's just the seasonal pattern. And I also think with COVID, we'll see, as you've seen the seasons change in Europe and some of these other places, you've started to see more prevalence. So I think you got to brace for that, and I think you got to, do things that, that are going to offer, offer protection, but particularly for folks who are, in that at-risk category. And I don't think there's one silver bullet. We required face masks and PPE in all these facilities back in the middle of March. We've supplied a lot of it. I think it's by and large been helpful, but obviously, you've seen outbreaks. And so there's a whole bunch of factors that I think go into it. But I think we'll get a sense of how this is going to play out in some of the northern parts of the country will likely see it before we see it. But we're preparing to have to deal with both of them.
Governor DeSantis, Claire Lopez-Orio here with NBC2. Talk to us about the consideration of reporting data, COVID data specifically weekly rather than on a daily reporting basis.
You know, I mean, I don't really have strong feelings about it. I mean, I think the issue is what we've seen with some of the data that comes in is there's a lot of problems with it. So, for example, we'll have some labs that will submit 200 positive test results and not submit any of the negative test results. Well, okay, so then the rate of positive is higher than it would have been if you do that. Obviously, if you did it over a week, there'd be a smoothing effect and you'd be able to do that. At the same time, I mean, you know, we do want people to get the tests in. And, you know, it is helpful to have information as real time as possible. So I'm not sure kind of how we're going to do it going forward. I just think having the most accurate information is very, very important. You know, people think that somehow like the state, you know, deals with like the test directly. Like the labs, they put it directly into the state system. And so we've had instances where a lab would put in 3 months worth of tests in one dump. It's happened a couple times. We've had other times where they've not put in any negatives, and that goes in. And once that's in, that's in. And so we've just seen that happen a little bit. But I think I don't think there's been any decisions made, and I don't necessarily have a firm preference either way. I just want it. You know, if you're going to submit 100 positive tests, then submit the 1,000 or 1,500 negatives at the same time. Don't submit that a week later because it kind of upsets the apple cart a little bit.
Mr. Governor, dealing with the fake news, maybe you criticized the government behind the state's unemployment system. We were wondering what you think of the HCA's decision to award $135 million to Deloitte for the state's Medicaid balance.
Well, so that is, I mean, Siobhan maybe will talk about that, but I mean, I think that's being, is that still under protest right now?
The entities that protest have dropped their protest. The agency is exploring its contracting efforts at this time.
And as you know, the governor is prohibited, and I don't get involved in any procurement. So people submit, and if they do the best bid, then they typically get it. Now, there was some, I think DEO had provided some input to the agency. You know, I wasn't involved in that either way. You know, my view would be that we would wait and do business with others before, but at the same time, you know, I can't go in and do that. And so I've not been a part of any procurement that's happened since I've been governor, and I don't think that it would be appropriate or lawful for me to do so.
Governor Frank USA Today, Florida, the order you announced today, is that something you're prepared to rescind should the numbers of cases go up? Like, for instance, today in Lee County, we're hearing that the number of hospitalizations related to COVID have grown sharply.
That's not true. So what's happened with Lee County is the reporting has been jagged. So they underreported and then so basically you see this sharp, and it's been smooth. I mean, so they have right now in Lee County there's 11 patients who are COVID positive in the ICU. 10 are being treated for COVID. 1 is incidentally infected with COVID, but being treated in the ICU for other things. And so my guys were looking at those numbers this morning about seeing this like up and down. You know, these things tend to follow a pattern. If you have 25 fewer hospitalizations one day and then 30 more than that, it usually doesn't work out that way. So I know that the agency has been in touch with some of those folks down there, and I think that they've gotten the numbers you know, where they need to be. But you know, total hospitalizations in Lee County are down dramatically from where they were in July. And I think that that's pretty much true pretty much everywhere in the state. I mean, Miami-Dade, for example, you know, their COVID positive patient census was over 2,000. I think they had about 2,300. Now, there's a chunk of those who were incidentally positive, who weren't being treated for it, but still, and now they're about 275 COVID positive patients are being treated in Miami-Dade County, which was the leading outbreak in the state of Florida. Our hospital capacity is, I think we've had 25% or more of our beds that have been available, both ICU and for general beds. And of course, with the ICU, we'll say that there's 6,100 or however many staffed ICU beds at a given time. The fact is they have capacity to dramatically expand that. But the total number of patients being treated for COVID statewide in ICUs is the lowest it's been, I think, since the beginning of June at the end of May. And so you've continued to see that trend, and you've also continued to see relatively stable visits to the emergency department for COVID-like illness. We had 2 weeks ago, it had been going down, and it kind of like stabilized, and like just a hair went up, and then the last week it went back down. And then my sense is so far this week it's been pretty much in keeping, with where they go. But these things, they'll bounce around to a certain extent naturally, even if things are fine. So some of it's noise, some of it's signal. But I think the ED visits are down dramatically from where they were at the beginning of July. And so that's something that obviously you monitor as well. But I also think that we look now at what's happening in different parts of the country, different parts of the world. Some of these areas that have had real harsh policies are still seeing, big outbreaks. You're seeing it in Europe. You're seeing it in parts of the Midwest here. So I think this visitation, we have the tools that we need. We've got the PPE. We've got the testing capability, and we're going to trust them to continue to move forward. So we are not going to revoke any of this. These facilities, if they have situations, they obviously can make decisions that's in the best interest of their residents and the families, and we support them doing that. But what I've found on some of this is, there have been instances in which you had some of these things had no visitors for a long time, and even locally there was even other restrictions in the community, and you still had outbreaks. And so it'd be one thing to say like, oh, if you didn't have this, you definitely wouldn't have outbreaks. That is just not true. So I think the most compassionate and humane policy is provide the tools, provide the PPE. Obviously, people understand this virus much better than they did 6 or 7 months ago. Continue to do that, but also continue to have the pathway for the families to be there for their loved ones. Because I think it's really, really important. And I think about so much is focused on, okay, who tested positive yesterday? What's the hospital? And that's all very important. But there's much less attention paid on the effects of mitigation or the effects of some of the anxiety and fear that's permeated society over the last 6 or 7 months. And I can tell you, you had folks in these facilities who had a tough time. When the families were able to reunite, it was a real weight off their shoulders. But also even outside of these facilities in the general community, you're seeing more problems with things like mental health. And I'm going to have an announcement on some mental health initiatives next week. You're going to continue to see that. We've definitely seen increase in drug overdoses, particularly opioids, and that's something that's really tragic. We had made a lot of progress on that, but the way society has gone through, it's been very difficult. So we've got to keep all those people in mind. And so I think this is safe. I think we're focusing where we need to. We're putting our money where our mouth is. But cooping them back up in their room, I just don't think that that's viable. Okay, got one more.
What's your reaction to the election threats made by Russia, China, and Iran?
So we have been, as you know, focused on the cyber. We've put a lot of money into it. When I came into office, I think a few months later, there was a report about potential 2016 election where there was some type of cyber against a supervisor of elections, not votes or anything, but that. So we've worked really hard. The Secretary of State's worked really hard with all the counties. There have been millions of dollars distributed. They have passed stress tests that have been done. And then when there were problems identified, those problems were rectified. Some of the vendors have gone through a lot of oversight and stress testing. The FBI has provided counsel both to the state of Florida and to the locals, as well as some of these vendors who are involved in the process. And so it's something we take very seriously. Fortunately, 2018, was relatively uneventful. Haven't seen as much this year either. But we understand there's a lot of different things that are out there. And so we are concerned about China, Russia, Iran. Now, Iran, what they were doing with these emails, that's kind of trying to get things in the zeitgeist with voters, which is a little bit different than attacking like a supervisor's office. But still, I mean, that's a terrorist regime, and, we don't want them to be involved in anything we're doing. But, our goal on this is, have a safe, successful vote. Be able to to certify a winner and make sure everyone has their voice heard. I would just remind people, most parts of Florida do have early voting open. So if you want to go, and I think on Saturday it'll be everyone will start, or certainly within the next couple days, all of Florida counties will have early voting. Of course, you still have the ability to vote by mail. Many Floridians have done that. This is not a mass mailing of mail ballots like you see in California, where they'll mail to people who have been at that residence for the last 75 years, and they'll send 15 ballots or something. That's not what we're doing here. It's by request. You request a ballot, you will get sent a ballot, and then you send it in, sign it, and it will be counted. So it's a safe system here, and I think it's a responsible system. So people should feel comfortable doing the mail-in voting if that's what they would prefer. But we are going to obviously continue with early voting, and then Election Day, it's going to be a full election. All the polling places will be open. People will be able to go. We've made preparations to make sure that there's enough personnel and staff as whatever needs to be. So I think you have a variety of ways to make your voice heard. I know a lot of people have sent in mail ballots. Seems like the early voting has been very popular so far this cycle as well. So we anticipate continuing to see that, and we think that there's going to be a really strong voter turnout in the state of Florida, which is a good thing.